Hi there, my name is Gerard Greene. Welcome to our specialist pelvic health physiotherapy clinic in Birmingham in the UK. And what I'm going to do is just a very short, rapid video on reverse Kegels. So we get a lot of our male pelvic pain, female pelvic pain patients, our hard flaccid patients, our athletic female and male pelvic dysfunction patients doing reverse Kegels, but they're difficult to do. So what positions can we do them in? So what we can do is we could get into a nice supported position. We could start off doing a minute or two of relaxed belly breathing. And if you're wondering how to do the belly breathing, there's a really nice belly breathing video on our YouTube site. So we do a minute or two of belly breathing. Then what we can do is take a nice breath in, nice belly breath in, and at the same time, just very gentle, as I'm breathing in, tummy's going out of it, I'm going to very gently push down through the back passage. It's easier to push down through the back passage because we've got, and that's a bigger area, it's a bigger sphincter, we've got more receptors there, it's easier for us to feel that. So breath in, gentle downward pressure, hold, 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 and let go. The emphasis here is on gentle pressure. And when you get really good at this, you have to do very minimal pressure. But a lot of the guys struggle. A lot of the guys feel they have to push down hard. But that will make things worse. It's really nice breath in, gentle downward pressure. Hold for a couple of seconds, let go. Maybe doing 10 of those. What are some other positions? A really nice position to do it in is a supported squat. So this is where you drop down either on the heels or on the toes. In my case, the toes. And I'm going to really support a little bit of weight here. Knees are apart. Initially, I'm going to do a couple of minutes just big belly breathing. When I've done that, I want to do some reverse Kegel. So when I do the reverse Kegel, I will take a nice breath in, big belly breath in, gentle downward pressure. And you can feel a nice opening there around the rectum. Hold, 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 and let go. Nice belly breath in, gentle pressure down, hold, hold, and we'll do about 10 of those. Some people like this position. Some people, they're a bit stiff in the knees and hips, don't like it. So another position you can experiment with is in child's pose. Knees apart, we will drop down, start a little bit of belly breathing, and then nice breath in, gentle downward pressure. Nice breath in, gentle downward pressure. Another position a few of my patients like is in 4-point kneeling. Knees nice and far apart. Nice big breath in, gentle downward pressure. And that pressure is gently out through the back passage. Lots of our patients, they have to sit a lot, especially now there's lots of Zoom warriors, team warriors out there. So in sitting, what I could do is belly breath in, gentle downward pressure. Almost like you're gently pushing down into the seat. Tends to be a little bit easier. These probably aren't the best chairs for it. Tends to be a little bit easier if you maybe tilt that pelvis forwards a bit. So I can lift up the sternum, tilt forwards a bit, nice breath in, gentle pressure down. People want to know, well, how many reverse Kegels do I do? And I think the answer to that is not too many. I think I'd start with build maybe 5 to start with. Refine the technique. How do you know if you're doing it properly? You need to have very, very gentle downward pressure. You shouldn't be pushing down. It's a very gentle lowering, gentle movement. Once you can do 5, build up to 10. Find what position is better for you. So what position do you feel more of a dropping, a downward movement? Maybe even do those a couple of times a day. Those of you who are getting lots of problems with sitting and driving, you probably do a few more in sitting also, because that reflects the position you're in. So you might do some in sitting, but some in the other positions as well. And really, if you're doing reverse Kegels, you should also be doing lots of the belly breathing also. The belly breathing is very separate, and if you want to find out more about that, just go to our YouTube page and it's on that. Many thanks.